How to understand genetic testing for breast cancer. Genetic testing for breast cancer is a way to look at your DNA to see if you carry gene changes that might increase your risk of developing the disease. It mainly focuses on genes called BRCA1 and BRCA2, which normally help repair damaged DNA and prevent abnormal cell growth. When these genes have mutations or changes, the risk of breast and ovarian cancers can go up significantly. The testing process usually involves giving a blood sample or a saliva sample. The lab then examines these samples for mutations in the BRCA genes and sometimes in other genes linked to breast cancer risk, like 8TM, CHEK2, PALB2, and TP53. Modern tests often use panel testing, which looks at multiple genes at once because mutations in several genes can contribute to the overall risk. It's important to understand that genetic testing isn't recommended for everyone. Usually, healthcare providers suggest testing if you have a personal history of breast or ovarian cancer, or if your family has a history of these cancers. A genetic counselor or doctor will review your medical history and family history to decide if testing makes sense for you. When you get tested, the results can be one of three types. A positive result means you carry a mutation that can increase your risk of cancer. This information can help you and your doctor decide on more frequent screenings or preventive options. A negative result means no mutation was found, but it doesn't completely rule out risk because some mutations are not detectable or might not be known yet. Sometimes, a test finds a gene change called a variant of uncertain significance. This means it's unclear whether that change increases your risk or not. Because interpreting these results can be complicated, talking with a genetic counselor before and after testing is very helpful. They can explain what the results mean, what options you have, and how to manage your risk. Remember, genetic testing is a tool to help guide your health decisions, but it's just one part of a bigger picture. It's always best to work with healthcare professionals who can provide personalized advice based on your unique situation. In summary, understanding genetic testing for breast cancer involves knowing which genes are tested, why testing is recommended, and what the results can mean. It can provide valuable information to help you take proactive steps for your health, but it should always be done with professional guidance to ensure you fully understand the implications and follow-up options. Always consult your healthcare provider to see if genetic testing is right for you and to discuss what the results might mean for your future health.